answer that question.
Healthcare a human right? Is healthcare a human right?
In the way that free speech is a human right,
Yeah.
I would say it's different, because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool.
Well,
and so are you guaranteed the same right, or is there also
look,
a duty?
I'm sorry. I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right. You've talked about the drug companies, and maybe we agree.
You said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this question.
I don't think any of them want to give me money, by the way. And all these Democrats are opposed to me for partisan issues. They used to be my friends, agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on.
Hey, it was as dramatic as I thought it would be. So you saw from the intro, RFK is on his confirmation hearing, and there's a lot of good clips in that 3.5 hour setting that he sat there and he took questions from Democrats. And as the intro, I decided to end on his point of talking about the partisanship from the Democratic Party and how many people are reacting to this. Tim Pool, as you guys know, I like to listen to him for a more centrist opinion. This hearing proves Democrats are effing evil. RFK is one of the most moderate voices on health. For once, we have a nominee who will actually do his jobs, but Democrats are bought out by Big Pharma. The reason I'm bringing up this case from Tim Pool is because Elizabeth Warren, the one that was asking RFK these questions about conflict of interest, we're going to get into it a little bit in this video. There's so much clips, so little time. But before I go even further, you saw Bernie Sanders asking him about, is healthcare a right? And the way that RFK answered that question, it was perfect. He was like, free speech don't cost anybody anything. It's different. Now, if you make a personal decision that puts you more at risk to use public health or whatever, this is why socialized healthcare, this is why nationalized healthcare is not a good system. It's not a productive system, because essentially you're making everyone pay the same thing when everyone is not taking from the system the same way. I want you to show this clip about how RFK is actually seeing this. He don't see Republican kids. He don't see Democratic kids. He's just continuing highlighting how, hey, I just want transparency.
Parent.
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know anybody with a food allergy growing up. peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them, and I know how to fix it. And there's nobody who will fix it the way that I do, because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is, we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them, from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum.
And it's partisan stuff. It's partisan games like this is why Dems' favorability is under the water by 26%. By 26 points, while Trump enjoys net positive rating, polls show. Trump job approval is 10 points higher than it was in the beginning of his first term, right? And I just want to focus on the Democrats here because the polls who surveyed over 1,000 registered voters from January 23 to January 27 found that 31% of correspondents has a favorable view of the Democratic Party, only 31%, while 57 have an unfavorable view. And among independents, which is my voting bloc, which is the political group I'm part of, I'm a conservative independent, I'm not registered to do any party, the numbers get even worse as only 22% have a favorable view of the Democratic Party. And, you know, because my main criticism I get on this channel is that people think I have a negative prejudice against liberals and Democrats. It's not I have it's just I have a prejudice and negativity towards the actions and behaviors of your party that you continue to support. Right? And you're going to see it a lot through this hearing because the Democrats pissed me off a lot about some of the questions they were asking RFK. Oh, are you going to do corruption? You want to know also another reason why I, as a conservative independent, have such an unfavorable view of the Democratic Party and liberals in general and the media, who Democrats, 58% of them trust the media. This is who majority of Democrats trust for their news. Media before and after RFK joined Trump. Why ultra-processed foods are so bad for you. And then the next one after after RFK endorses Donald Trump. What if ultra-processed foods aren't as bad as you think? This is the media that the Democrats majority of the time believe and trust. Make it make sense. Make it make sense. But, you know, I digress. I don't want to hop on this point. There's a lot of videos that I want to get through. I want you to watch this exchange between a congresswoman and RFK, and then we'll get into a live reaction clips. Let's take a look.
So it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving forward,
You want me to
knowing
answer
that
the
it's going to
question,
harm
Senator?
Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in a
is that the
unique
only reason
position.
why you're at HHS? Is that the
Excuse
only
me?
reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Y'all better confirm that, man. How can you not confirm that? He wants transparency, right? He highlighted the problem. Like, look, we have chronic diseases. What's the cause of this? He's a detective. Like that's how I think about things. I'm a detective. I find, okay, what's the reasons? Okay, what could be the true motive? What's the probabilities? Like, what is contributing to these factors that how we disproportionately represent COVID deaths when we only make up 4% of the world's population, right? Like, this is the funny part about Democrats and a lot of people who trust them and believe them and vote for them. They'll want to sit here and complain, oh, black people are disproportionately in jail, right? And they're not curious about the answer. They just say, oh, it's racism. Oh, Americans are just unhealthy. Okay, why? Right? The same question I asked, why are black people disproportionately in jail? Oh, Kenny, black people disproportionately commit more crimes. Oh, okay, what kind of things we have in our food? Oh, look, we don't exercise as much as other countries. Look at the food stuff. We have a bunch of ultra-processed stuff in amongst our food that could be contributing to our health. Do we have any studies for that? Some suggest, some doesn't suggest. There's no consensus there, right? But we have a sneaking suspicion that ultra-processed foods is what's hurting Americans' health. It could be other things as well. And all RFK wants to do is, hey, I want good studies to validate what we're doing. Hey, there's a reason why these European countries are not allowing these certain vaccines to be allowed in their to be administered to their kids. There's a reason why certain countries are banning food dyes, processed ingredients, artificial flavorings, all that stuff for a reason. We need to make sure, hey, are we making sure we're doing the correct thing for our people, for our health? And if you're looking at the outcomes, Americans have some of the lowest life expectancies compared to everyone else in the world. That should be alarm bells. To me, like I said on this channel, if you follow me, if you're new here, I am very results driven, right? Results, and we work backwards because I'm assuming cause and effect. That's how my brain works. If there's an effect, what's cause? There's a cause. There's always a cause. And my argument is, what is the cause? We have to find the cause, the most high probability cause. And our health system sitting here thinking about they don't need any transparency. They're giving American people redacted data. Who are you protecting? This is the conflict of interest that RFK is set to expose. Today, Americans' overall health is a grievous condition. Over 70% of adults and a third of children are overweight or obese. This is unacceptable. Imagine that Ozempic, right? 70% of Americans are overweight. A third of children are overweight, and it so happens that pharmaceutical companies came out with a drug called Ozempic to help them lose weight. How convenient. One thing about why I don't like to use drugs is there's always a side effect. There's always a trade-off you're making whether you're aware of it or not. So I want to show you the clip where I talked about how RFK had a debate about healthcare and why he believes many Americans actually like private healthcare. And we're going to see some of his sources. Let's take a look.
Americans by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance.
It's like that in Canada, too. And I know Canadians going to come in here and give me flack about, oh, you're an American. You don't know about our healthcare. Hey, look, there's a reason why a lot of people, even though they have free healthcare in Canada, they go to private healthcare. Like y'all a case study. Y'all allow both systems. Y'all a case study. If free healthcare was so good, why is not everyone on it? Results. That's all I care about. I don't care about your intentions. I don't care about your feelings. I care about the results. And if the results are not good, or the results say something otherwise, hey, there's still people on private insurance. Why? If I look at the contrast between private insurance in Canada versus the public insurance in Canada, I realize, oh, people who have private insurance, they have shorter wait times. They get more immediate care. While in Canada, if you do the free healthcare route, you're waiting damn near a month to get seen. I'm just saying.
We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country.
And that's one thing I agree. When people say, hey, I want to change the healthcare system, that's what I agree to. I want some type of reform, right? I want some type of, we're fixing something, we're adjusting something, right? And this is something we need to see. So for my last clip of the day, because I'm telling you, there's so much you can go through in this video, but I'm trying to keep it short. I'm trying to keep it short. I'm trying to keep it sweet. I'm trying to keep it punctual. I'm trying to go for impact here. And I think this was the most impactful discussion. Now, I want to point out with Miss Elizabeth Warren here is that she's going to try to expose him for conflict of interest. Oh, you get it's profitable for you to sue these health companies. How I know you're not going to abuse your position in government to aid you in making money off of suing these corporate pharmaceutical companies. Problem is, and if I was RFK, I would have pointed this out. Elizabeth Warren is paid almost what? $800,000. She's accepted over $800,000 from big pharmaceutical companies. And it goes back to my point. It goes back to the post that I highlighted with Tim Pool about how the Democrats are in the pocket of big pharma, right? Democrats love to bring out this fact that a lot of Republicans are bought and paid for by the NRA. But then when you realize, oh, I can make the same argument about Democrats with big pharma, there's a reason. You have a vested interest in protecting the credibility of vaccines, health experts. You have a vested interest in keeping the system as is right now, to the point where you'd rather give us free healthcare, where it's going to be very expensive here in the United States to do free healthcare. And we're so big of a population that it makes free healthcare is essentially impractical for the United States of America. For our population size, for the health choices that Americans make, it'll be way too expensive to do it here compared to Europe. And this is the funny part is, and I'm sorry I'm going on this long-winded rant when you was trying to see this video, but I have to say this before I get into this little debate here. In Europe, a lot of socialists love to take credit. Oh, look how healthy Europe is. It's because they have free access to healthcare. No. It's the opposite. They are able to do free healthcare because they're so healthy. They're not healthy because of the free healthcare. They're healthy because they get free healthcare because they're healthy. Look at the portion size that Europeans eat. Look at the average weight of Europeans. It's a lot cheaper to give them free healthcare because they have less likely to go into chronic diseases. While here in America, it's rampant. Because what decides you being insured is your frequency of using their insurance. If you're sick all the time, that's why people who tend to be sick all the time have more expensive health insurance than people who are healthy, like such as myself. I have no pre-existing health conditions. I'm fairly healthy. I fairly get exercise, right? My insurance is going to be cheaper. I don't smoke. My insurance is going to be cheaper compared to someone who has constant chronic diseases. They'll use the insurance more frequently, therefore they're more expensive to insure. But when you do national health care, it's unfair to me who's taking care of myself, and me and you are paying the same thing for healthcare. Like it don't make any sense. And you're the ones using the resources more than me, but I'm paying the same as you. Does that sound fair? Socialists love to claim about fairness, but they don't see it. They don't see this as unequal, unfair. But I digress. I'm done. Let's get into the discussion between Elizabeth Warren, Big Pharma shill, and RFK.
I'll comply with all the ethical guidelines.
That's not the question. You have said
You're asking me, Senator, you're asking me not to sue pharmaceutical companies. Yeah, you are. That's exactly what you're doing. Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country.
Which will hurt her donors because these people donate to Elizabeth Warren's campaign. So I can see this as a way of you protecting your economic interest, right? Your political interest. That's exactly how I can frame it, right? I digress.
And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it.
And you're making millions of dollars in your donating contributions from these pharmaceutical companies by protecting their interests, by protecting the status quo, which has not been giving good outcomes for the American people. If what was going on working, we should be some of the healthiest people in the world, but we're not. And all RFK wants to do is review everything, review all our preconceived notions. That's it. There's a preconceived notion that vaccines are inherently good. Sure. But still, we have to review the data because we have discrepancies. Europe don't have the same vaccine schedules that we do. Europe has less vaccines than we do. So it's less is more. Could be more for us. We don't know that because they won't let you see the information. And this is the problem. This is why no one has trust in our institutions, because there's no transparency. That's his number one ethos. That's the number one thing I led up to in this video with RFK. Transparency is the key word here. I'll let the video finish out.
Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary
Hey, how about you agree to that instead of trying to get him to say, hey, I don't want you to go after my guys that give me money.
of HHS?
Clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the finance.
This is where she gets bit. Like, this is where Warren looks like she was just doing this all for the camera. Watch this.
Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
So she's trying to get him to agree to more than what is required for him to get confirmed. Essentially is what Elizabeth Warren was doing here. Political. You wonder why people don't like y'all. Oh, no, I'm done. I'm done with this mess. I think I went over long enough. I think you guys got a good general sense of what's going on the confirmation hearing. I hope that you guys found this video insightful. Don't forget to like, comment, subscribe, and share this video as well. It really do help me out in the algorithm. And I'll catch you guys on the next one. Peace.